Good morning. I am Michelle Lee, and I am a registered dietitian and the Dietetic internship professor at East Tennessee State University. Today we have Nicole Litwin and Marion Stiles, who are ETSU Dietetic interns and grad students, who are actually going to be here today to talk to you about managing your cardiovascular disease and then also some stroke prevention tips. So I'm going to turn it over to them.
All right, like Dr. Lee just said, we're going to talk to you about cardiovascular disease, but you might know it better as heart disease. And heart disease describes several heart problems that are all related to the heart and the blood vessels. Heart attacks and stroke probably come to your mind first when you think about heart disease, but there's also high blood pressure, chest pain, poor circulation, abnormal heartbeats, heart failure, heart valve problems, and coronary heart disease are all forms of heart disease. Heart disease affects many people in America today, including both men and women. It affects about 80 million people, which makes it one of the leading causes of death in the United States. Many of these deaths are usually from stroke and heart attack, but they're completely preventable and within your control. But there are a few factors that aren't within your control. The ones that aren't within your control are family history. If you had a first-degree blood relative who's had a stroke or coronary heart disease before, the age of 55 for a male and the age of 65 for a female, your risk for heart disease increases. Do you have anyone in your family that has heart disease? Or?
I don't.
No? Okay. And your age is a risk factor. Simply getting older increases your risk for heart disease. Men, it's over the age of 45, and women, it's over the age of 55. Your risk for stroke also doubles every decade past 55 years of age for both men and women. Your gender is a significant risk factor. As a man, you're at a greater risk for heart disease. The same as, and then for a woman after menopause, you're at a risk for heart disease, the same as a man. And then your ethnicity, men and women of African American, Mexican American, Native American, Native Hawaiians, and Asian Americans are at higher risk of developing heart disease than other ethnic groups. And then some risk factors that you can control are high blood pressure. If your blood pressure is higher than 140/90, that's considered to be high. And this causes your heart to work and pump harder, which can cause stress and injury on your heart. And this increases your chance for heart disease, a heart attack, a stroke, heart failure, and even sudden death. Abnormal lipid levels in your blood, such as high cholesterol, high LDL cholesterol, which is the bad cholesterol, low HDL cholesterol, which is the good cholesterol, and high triglycerides increases your risk for heart disease. And the lower these levels are, the lower the HDL level is and the higher the bad cholesterol is, then the greater your risk. And when your bad cholesterol levels get too high, some excess cholesterol can build up in your artery walls. And over time, this builds up and is called plaque, as you see here. And it makes it difficult for blood to travel through the artery. And when this is filled up about 75%, it can form a clot, as you see down here, and then the blood can completely stop from flowing through, and this causes a heart attack. And so when your abnormal lipid levels go down, then your risk for stroke goes down. Do you know what the desirable range for cholesterol is?
Do you know?
I'm not offhand, no.
No, it should be less than 200. And you can achieve these levels by eating a healthy diet and staying physically active. And tobacco use is a risk factor. Whether it's smoking or chewing tobacco can increase your chance of heart disease. The risk is especially high if you started smoking when you're young, if you're a woman, or if you smoke heavily. Passive smoking and secondhand smoke does also increase your risk. And simply stopping smoking can reduce your risk no matter how long you've smoked. Excessive alcohol can raise your blood pressure, cause heart failure, and lead to a stroke. It also raises your triglyceride levels in your blood, and it can contribute to irregular heartbeat. Being physically inactive can increase your risk for heart disease, the same as having high blood pressure, high cholesterol, and smoking. Eating an unhealthy or poor diet that's high in saturated and trans fats, as you can see here, and it's low in fruits and vegetables and whole grains, can increase your risk for heart disease. Being overweight or obese with a lot of excess fat in your stomach area puts a strain on your heart and can raise your blood pressure and your cholesterol levels and lower your good cholesterol levels and increase your risk for heart disease. And diabetes of any form, whether your blood glucose is under control, can increase your risk of heart disease. Stress can also lead to an increased risk because it's often associated with smoking or overeating, I guess you could say, and then these are factors that aren't typically considered to be heart healthy. And so the more risk factors that you have, the greater your risk for heart disease is. And in order to prevent heart disease or decrease your risk of getting heart disease, you can follow a heart-healthy diet and make certain lifestyle changes. A heart-healthy diet is rich in fruits, vegetables, and whole grains. You want to aim for about 3 to 5 servings of vegetables per day, whether they're fresh, frozen, or canned. But you want to watch out for added salt or fat. And for fruits, you want to aim for about 2 to 4 servings per day, whether it's from fresh, frozen, canned, or dried fruit. But you want to watch out for added sugars in the fruits. And this is usually found in canned fruits. The diet's also high in whole grains. You want to aim for about 6 to 7 servings per day and make at least half of these servings whole grains, such as whole wheat, brown rice, quinoa, rye, barley, and oats. You want to aim for about 2 to 3 servings of low-fat or fat-free dairy. For meat, you want to choose lean meats like lean hamburger meat or skinless chicken or pork tenderloin, and even lean deli meats like roast beef and turkey instead of bologna and salami. It's also recommended that you consume fatty fish like salmon and mackerel and tuna and sardines at least twice a week because they have a healthy fat in them called omega-3 fatty acids that lower your cholesterol and your triglyceride levels in your blood. You also want to limit foods that are high in saturated fat, trans fat, and cholesterol like processed meats and butter and lard and regular mayonnaise and high-fat dairy such as sour cream and whole milk and cream cheese because this helps to maintain or reduce your blood cholesterol levels. We actually brought some fat tubes that have, it shows the fat content in some of these foods I just mentioned. And even eggs are high in cholesterol. You want to try to eat less than 2 egg yolks per week, or you can switch to egg whites or egg substitutes to help lower your cholesterol.
You have a McDonald's French fries in here. The tube is full of fat.
I don't need a lot of them. So
Yeah, and then here's your regular potato chips. It's full of fat too.
And how many? Is this one serving?
It's 1 ounce, 12 to 20 chips. Here's my ice cream. It's not quite as full, but yeah, this is pretty scary, isn't it?
All right, and you also want to limit your intake of foods and beverages that are high in added sugars like candies and sweets and pastries and sodas and fruit drinks. You want to try to eat more nutrient-dense snacks like fruits and vegetables or nuts and seeds and like whole grain crackers and choices like that. You also want to choose and prepare food with little to no salt. You want to aim for less than 2,300 milligrams per day of sodium, and you can do so by looking at the sodium content on the food label on the back of foods and choosing the foods with the lowest number. You can try to not add salt to already prepared foods, limit the amount of like processed and frozen foods you eat. You can also choose foods that say reduced sodium or no salt added or low sodium when you're grocery shopping to help lower your sodium intake. And you can also follow the DASH diet to help lower your sodium, and it also helps prevent your risk of getting heart disease. And now Marion's going to talk to you about some changes you can make in your lifestyle that are more heart healthy.
Right. Yes, besides the healthy diet, avoiding tobacco use, like Nicole mentioned, that greatly reduces your risk. And I know that it's hard if you do smoke gum. Setting attainable goals and seeking the right resources is helpful. Limiting alcohol. Do you know how many a day is recommended, or not recommended?
Not to exceed.
I don't have that problem.
It's actually men 2 drinks a day and women 1 drink a day. But I recommend a limit too. And then aim for a healthy weight. Balance your calorie intake with your physical activity. Watch your portion sizes to get your calories down. And be physically active. Find what you like. You know, you said you like walking, and that's wonderful.
I think our friend here has that all taken care of.
I know, it sounds like it. Preaching to the choir. And then, so just some tips to go over, because it can be really confusing when you're in the grocery store to try to find out what you're buying. And label reading, you have to know how to read a label, and that can be really confusing too. Because you first want to look at the serving size, which is listed right here, and that's not because everything on the nutrition facts pertains to the serving size, not what's actually in the container, which is, it might be 1, but it might say 1 cup or whichever. And here where your calories are. Your total fat. When you look at total fat, it's best to choose under 5 grams, foods that are under 5 grams. You can think of aiming for 50 to 75 grams a day is a kind of normal range to aim for. So just keep that in mind when you shop for things. Do you know which type of fat is healthier for your heart, unsaturated or saturated?
I think the unsaturated.
That's right. You got it. That's right. So we want to look for a low number of saturated fat on the label, and trans fat as well. You really want trans fat to be 0. And one thing that's tricky is that sometimes labels will say 0 trans fat because it's just the serving size, but you have to look on the ingredients to see partially hydrogenated vegetable oil. That's something if you want to look into that. But you really want to get this down to 0, and the lower the saturated fat, the better for your heart.
Can I eat a 0 fat diet?
No. Oh, no.
It would be hard.
It would be hard, and wouldn't be that great for you. You had to eat a 0 fat diet, no. But you can eliminate trans fat, eat lower saturated fat, and just kind of keep your
look for
limited.
the better fats and just keep it as low as possible.
You'll see polyunsaturated fats under the. We actually don't have any on here, our label, but polyunsaturated, monounsaturated, those are the better ones. Your cholesterol, you want to keep that down as low as possible, like Nicole was saying. Sodium, when you think about sodium, you don't want to eat more than 2,300 milligrams a day. So if you can kind of put whatever, like this is 640. So, and these give you your percent daily value. So if 640 doesn't mean anything, you can always go over and that's 27% of the whole day, and do I really want to spend it all now? But and then here are your total carbohydrates. If you have high triglyceride levels, you might try to keep each food that you look for under 30 grams. It's like a good rule to go by. And then dietary fiber. This you want to be higher. You wanted to keep it above 5 grams or more. The higher the better, really. And those are your labels. So then when you go into the grocery store, you want to fill your cart up first with fruits and vegetables. That's a good strategy, and then get the other stuff later. And we'd recommend fresh fruits and vegetables first. Do you know why we would do that?
I guess they add less stuff to it.
Yeah.
Less chemicals and stuff,
Yeah. Processing.
And that's right. And so, yeah, sodium. A lot of times they'll sneak a lot of sodium, a lot of salt into that. And I put up, I don't know if you can see here, fresh and frozen, or canned and frozen foods are fine, but you just have to read to make sure that they're all right, you know. Here's a Green Giant, and it says select, broccoli florets, no sauces. That's a great thing. That would be a good one. And this is a stir-fry mix, and it's got a teriyaki sauce or something on it, which, you know, it might be okay. You just have to look at the label and see if it's got high sodium. It can be high in fat, even though you think you're eating vegetables. It can stick some stuff in there. And then you can season it back at home by yourself, and it's probably going to be a lot healthier.
So buy plain vegetables, frozen vegetables, and just make my own sauces or put my own seasonings on it?
That's what I would suggest. And then fruits are similar, and fresh are always the best way to go. But in cans, as long as they're in their natural juices, is fine, and not in the sugary syrup and things like that.
Can I just rinse them off though?
Yeah, if you have some at home that you've already bought. Yeah.
Yeah.
Pour the juice out.
Pour the juice off and rinse it.
Yeah. Because they're already so sweet. Right. And then with breads and cereals, and grains sort of foods, you always want to look for whole grains. And but to do this, and look for fiber. You know, let it have at least 5 grams. You really want more. I mean, and then on your ingredient list, the way to know if it's whole wheat, it should be the very first ingredient on your ingredient list, and it should say whole wheat or whole oats or whole rye. Whole grain. That's the first. So that's what you look for there. And then with milk and dairy, you choose, just low fat. And you have to look for sodium in cheeses too. Some of those are really high, but you can get lower sodium cheeses and lower sodium and lower fat, reduced fat cheeses too.
Yeah, I've seen them where the cheese slices, they now make them with skim milk.
Right. So. Yeah. So there's nothing weird about it. They're just making it. With lighter milk. And then meats, another you want to get white, leaner meats. For chicken breast without the skin is a good way to go. Like you were saying with beef and veal, leaner cuts of beef is fine. And just try to not get pieces with a lot of marbling in it. That's the fat. And things that say, and fish, like you said, the omega-3s, we love those. Those are great for your heart loves those. And experiments with vegetable proteins too. It's a great way to go because it's a lot lower in saturated fat. It's high in fiber, and still might have to watch sodium, but you still look. And so tofu, beans, things like that are great protein sources.
Have you ever tried tofu? I haven't either.
Do you eat a lot of fish?
Yeah, quite a bit. Yeah.
What's your favorite? What do you usually eat?
Well, I like that all.
Whatever's on sale at the grocery store.
Right. Salmon?
Do you do
like
salmon?
Yeah.
I do tilapia a lot.
Yeah, I like tilapia too, yeah.
Food's Good City has some good deals on fish a lot of times. We'll always check and see.
I see you marked the Spam off my list, though.
Yes, Spam is marked off because, and that's one thing, fish is great and tuna is great, but you really have to watch out for these potted meats like that. They're really high in sodium, and especially Spam is high in about everything bad that we talked about. But even tunas, you want to look for tuna in water, and you want to look for a lower sodium on it. And some of them will even advertise like this one has no salt added.
Okay. Well, I usually rinse my tuna too, so that can take some of that sodium off.
That's a good idea. Because these might be, I think these are a little more expensive brands, and that's why you like tuna. And then with convenience foods, these prepackaged foods like Hamburger Helper can be really high in sodium and sometimes even fat too. And so it's always best to just prepare it yourself. And things like that, not use these instant things, or just read the labels again. You know, some of them might be okay. And I think that, and then with cooking, Just to go over a couple of cooking tips, like we could have a whole session on this, but when you're cooking, when you're baking, instead of using sugar, you can use things like Splenda. You can get a big packet of Splenda and just substitute it for your sugar, which is a no-calorie sweetener, which is a great trick. And then take the skin off poultry, like we said, before cooking it, or at least before serving it. Bake, broil, roast, do things like this instead of frying. Drain the fat off of your ground beef. Experiment with different ways to cook fish. When you're cooking something in a skillet, try using a brush or something like a brush to just brush the oil on instead of doing the drizzle, because a lot of times you don't even need that much. Using egg whites is a good idea. And with your oils, olive oil and canola oil are good options to go with, because some people don't like olive oil. Is great, but I know some people don't like the taste of it. I think extra virgin is a little stronger taste, so you can get the other one. Not as bad.
I use olive oil for certain things, but I don't like it in my cooking, but breads and stuff, so I'll use a canola oil for my baking.
Okay, that's good.
But that's just my preference.
And canola oil can be a little cheaper too, which is helpful, which is a nice part. And then instead of Crisco and things like that.
Do you have any Crisco in your house?
No.
I don't either.
Oh, and one more to change it. But and then just use herbs and lemon juices and spices and peppers and onions, and experiment with flavors that you like that can add a variety of. It can make your best flavors to your food without having to use salt. Okay, and don't use table salt. Don't even put it out on the table, which is a great way to go. So. The 3 take-home points are: follow a heart-healthy diet as best as you can. Try to make the lifestyle changes that we talked about if they are a problem. And be physically active, and that can really help reduce your risk of heart disease.
Okay, great. Thank you.